There are some health topics that, well, they don't get a lot of casual conversation, even though they're really common. Bacterial vaginosis, or BV, is definitely one of those.
Hmm.
So in this deep dive, our goal is simple: to kind of get straight to the most important need-to-know information about BV and make it crystal clear for you.
Right.
We're pulling this information from Porth's Pathophysiology Concept of Altered Health States, the 11th edition from 2025, a solid, reliable source.
That's right. It's a comprehensive textbook, yeah. And we've sifted through it to bring you the core understanding of what BV is all about.
Okay, so what exactly is BV? Like, what are we talking about here?
Well, at its heart, BV is a non-inflammatory condition in the vagina. The most noticeable sign is often a change in discharge. It might be thin, white, or grayish, and often has a distinct odor.
And it's surprisingly widespread, isn't it? The numbers are pretty, well, eye-opening.
Absolutely. The source indicates that around 21.2 million women between 14 and 49 experience BV each year. That really underscores how common this is.
Wow. Now, what are some of the things that might make someone more susceptible to BV?
Oh,
Is it an STI?
it's not classified as a sexually transmitted infection, no. But we do see a correlation with sexual activity, particularly with, new or multiple partners.
Okay.
Interestingly, things like frequent douching can also increase the risk. Another key factor is a reduction in the amount of healthy lactobacilli bacteria that naturally live in the vagina. Think of those as the friendly gatekeepers.
Friendly gatekeepers. Yeah, that makes sense. So what happens when those gatekeepers are less present? How does BV actually develop?
Right, when they're less present. This is where it gets interesting. Normally, those lactobacilli produce hydrogen peroxide, which helps maintain a healthy acidic vaginal environment.
Mm-hmm.
In BV, when their numbers decrease, other types of bacteria, including anaerobic bacteria, can thrive and, well, multiply.
And this overgrowth of anaerobic bacteria, that's the problem then.
Exactly. As these anaerobes increase, they produce compounds called amines, right, which are responsible for that characteristic odor.
Gotcha.
These amines also cause the vaginal pH to rise, creating a less acidic environment. So it's a shift in the balance.
So the change in discharge and the odor are key clues. What else helps doctors diagnose BV?
Besides those noticeable symptoms, yeah, an elevated vaginal pH is a significant indicator. And when a sample of vaginal fluid is examined under a microscope, the presence of what we call Kluwer cells is another important sign.
Clue cells.
Yeah, these are basically vaginal cells that appear to be coated with bacteria, signaling that imbalance. It's really the combination of these factors, the symptoms, the pH, the Kluwer cells, that leads to a BV diagnosis.
Okay, right. So if someone is diagnosed with BV, what's the usual approach? What's the treatment, and what's the general outlook?
The main goals are to relieve the discomfort of the symptoms and also to prevent potential complications. These can include a slightly increased risk of acquiring other STIs, and in pregnancy, there's a concern for preterm labor.
Okay.
The standard treatment involves antibiotics, which can be taken orally or sometimes used as a cream.
And ultimately, what's the takeaway message about BV? Is it something serious long term?
Well, the good news is that bacterial vaginosis is a curable condition.
Yeah.
Treatment is typically very effective in clearing up the infection.
Okay, that's reassuring. So for you listening, remember this. BV is a very common vaginal condition, not an STI, often marked by a change in discharge and odor.
Mm,
It can be linked to shifts in sexual partners and practices like douching, which can affect the natural balance of bacteria in the vagina.
right.
When those protective lactobacilli decrease, other bacteria can overgrow, leading to symptoms and a change in vaginal pH. Diagnosis involves recognizing these signs we talked about.
Exactly. The discharge, the pH, those Kluwer cells.
And the really important thing to remember is that it's treatable with antibiotics.
And, this deep dive really brings home the idea of the vaginal microbiome as this delicate ecosystem. It's a reminder that many factors can influence these microbial communities within our bodies,
Yeah.
and maintaining that balance is important for overall health.
It definitely gives you something to think about, this sort of unseen world within us and how it can impact our well-being in noticeable ways. Thanks for exploring this important topic with us.